Take the subject's brachial blood pressure. As always, strict compliance with procedure is vital in assuring accurate brachial blood pressure measurement. Review the study protocol to determine which arm should be used for brachial blood pressure measurement and pulse wave analysis. Before performing a pulse wave analysis, make sure that you and your subject are in comfortable positions and that the surface that you use to support the subject's arm is completely stable. Depending on the individual study protocol requirements, assessments may either be performed with the patient seated or supine. The patient should be in the same position for brachial blood pressure and sphygmocore testing. Review the study protocol to determine which arm should be used for brachial blood pressure measurement and pulse wave analysis. Begin the process. Double-click on the sphygmocore icon located on your computer's desktop. To begin performing pulse wave analysis, click on PWA on the left-hand column of your computer screen. To enter a new subject into the database, click Create New and click Yes to verify. Enter all the subject information required by the study protocol. When the data has been entered, click Update to save the data and Yes to verify the entry. The subject identification will appear at the bottom of the patient list on the screen. For follow-up studies on subjects, do not create a new entry. Simply click anywhere on this row and the subject information will appear. To locate a subject, right-click on the list and sort. To begin an assessment, click the Study button near the upper left of the screen. Verify that the radial checkbox has been selected by default. Enter the subject's systolic and diastolic pressure values in the appropriate boxes. Enter the information required by the study protocol into the medication, notes, height and weight, and operator fields. Click the Capture Data button on the upper right of the screen to save the data. The sphygmocore system captures the radial blood pressure waveform by using the tonometer to slightly flatten the center of the radial artery by gently pressing it against the underlying bone. A tiny sensor in the head of the tonometer records radial blood pressure waveforms. The sphygmocore system uses a proprietary algorithm to derive the blood pressure waveform in the subject's ascending aorta and produces a wealth of central blood pressure data. To record the radial pulse wave, begin by locating the subject's strongest pulse point. Use just the tip of your fingertip and a gentle touch. Applying too much pressure or using a larger area will make it difficult to locate the strongest pulse point. Once you've located the strongest pulse point, you may wish to mark it, or simply note a nearby mole or freckle. Hold the tonometer in your dominant hand and use your other hand to support the patient's wrist, resting your arm on a stable surface. Allow a slight amount of backward flexion of the patient's wrist. You may use a small folded towel to promote this flexion, always making sure that the patient's arm and wrist are comfortable and not overflexed. Position the tonometer over the site of the strongest pulse point and prepare to take the measurement. Hold the tonometer firmly at the sides of the base, not the shaft, keeping the shaft perpendicular to the skin surface. Hold the tonometer over the strongest pulse point and visualize the dark gray sensing element at the center of the tip. Gently lower the tonometer so that the sensing element touches the strongest pulse point. Allow the tips of your fingers to rest on the patient's skin. Make sure your elbow, forearm, and hand are stable so the subject's hand is held without movement. When the tonometer sensor touches the skin, you will see a pressure signal on your computer screen. If you are applying too much downward pressure on the tonometer, the signal will climb to the top of the screen. If you are not applying enough downward pressure on the tonometer, the signal will fall to the bottom of the screen. Angle the tonometer and vary pressure until the pulse waveform is clearly seen on the screen. If you're unable to locate the pulse waveform after 15 to 20 seconds of altering angle and pressure, repalpate for the strongest pulse pressure location and try again. When the pulse waveform appears on the screen, at first it may look small, but if you see a smooth waveform, hold your tonometer position and wait until the wave reaches the right side of your screen, at which point the software will automatically amplify the size of the signal. If you're unable to achieve signal amplification, which tells you that a strong signal is being recorded, apply a little more pressure to the tonometer or look for a stronger pulse location. The goal in pulse wave analysis is to record about 10 seconds of consistent, continuous blood pressure waveforms, which takes 2 sweeps of the computer screen. The waveforms should be tall, filling at least half the screen. They should be of consistent height. The peak of each wave should be near the same vertical position on the screen. Each waveform should have a sharp upstroke, from the onset of the pulse to the peak of the wave. If you see a curve in the upstroke of the wave, this is artifact, which can be removed by slightly re-angling the position of the tonometer. When you believe you have seen 10 seconds of good quality waveforms scroll by on screen, touch the spacebar on your computer within 2 seconds. The Cvms system will record and analyze the last 10 seconds of recorded pressure waves. Remember, you have 2 seconds to hit the spacebar. When you touch the spacebar, the Cvms system will show the report screen. The report screen has 3 tabs: Detailed, Clinical, and Reference Range. In pulse wave assessment during clinical trials, your focus will be on the Detailed screen. Click on the Detailed tab. On the Detailed screen, the radial waveforms you collected, the average radial pulse wave, and the subject's brachial blood pressures are displayed in white. The subject's central blood pressures, derived from the radial data by the Cvms system, appear in yellow. The screen shows 10 seconds of aortic pressure waveforms, the average aortic pulse wave, and central blood pressures, all displayed in yellow. In the upper right-hand corner of the Detailed screen is the Quality Control box. As soon as the Detailed screen appears, check the Quality Control box to assure the assessment meets the quality control criteria defined in the study protocol. The system displays an overlay of the 10 seconds of radial waves collected during your assessment. The waves should be consistent in shape, with little variation. To the left of the radial waves is a column of colored numbers rating the height, consistency, and shape of the waveforms you collected in your study. To meet quality control criteria, all these numbers must be displayed either in green or white. If red numbers appear, or if a large red note label appears above and to the left of the quality control box, the study must be repeated. The operator index assigns a quality control score for each individual test. Many studies require that an assessment receive a quality control score of 80 or higher. Please refer to your study material to determine the acceptable operator index level. If the operator index level is below the acceptable level, or if red numbers or a red note label appear, the study must be repeated. If the study data meets quality control criteria, click the Print button. If the study needs to be repeated, click on Study, then click Capture Data, leaving the other patient data in place. For subsequent studies on the same subject, simply go to the patient screen and select that patient's name. Then click on Study.